Obsessive-Compulsive Disorder, or OCD, is far more than just a preference for organization or cleanliness. It represents one of several related conditions that significantly impact millions of lives worldwide. Today, we'll explore the complex world of obsessive-compulsive and related disorders, conditions characterized by intrusive thoughts and repetitive behaviors that can severely disrupt daily functioning. Understanding OCD. At its core, OCD consists of two primary components: obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. These aren't simply excessive worries about real-life problems, but are often irrational fears that the individual recognizes as unreasonable. Common obsessions include fears of contamination, concerns about order or symmetry, unwanted aggressive or taboo thoughts, and persistent doubts. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. These rituals are aimed at preventing or reducing anxiety or preventing some dreaded event or situation. However, these compulsions are excessive and often not realistically connected to the fear they're intended to neutralize. Examples include excessive hand-washing, checking, counting, arranging items in a particular way, or mental rituals like silently repeating phrases. The cycle of OCD. Individuals with OCD become trapped in a debilitating cycle. An intrusive thought triggers intense anxiety, leading to compulsive behavior that temporarily relieves distress. However, this relief reinforces the behavior, strengthening the cycle over time. What's particularly insidious about OCD is that many sufferers recognize their thoughts and behaviors as excessive or irrational, yet feel powerless to stop them. The disorder typically consumes at least 1 hour per day and causes significant distress or impairment. Related disorders. OCD doesn't exist in isolation but is part of a spectrum of related conditions with similar features. Body dysmorphic disorder involves preoccupation with perceived defects in physical appearance that are not observable or appear slight to others. Individuals may spend hours examining their flaws in mirrors or seeking reassurance. Hoarding disorder is characterized by persistent difficulty discarding possessions, regardless of their actual value, resulting in cluttered living spaces that compromise their intended use. The accumulation of items and inability to discard them causes significant distress and impairment. Trichotillomania, or hair-pulling disorder, involves recurrent pulling out of one's hair, resulting in noticeable hair loss. Similarly, excoriation disorder involves recurrent skin picking, resulting in skin lesions. Both disorders often serve as maladaptive coping mechanisms for negative emotions. Causes and risk factors. Research suggests that OCD and related disorders arise from a complex interplay of biological, genetic, neurological, behavioral, cognitive, and environmental factors. Brain imaging studies have shown differences in the frontal cortex and subcortical structures in people with OCD. There's also evidence of genetic components, as these disorders often run in families. Environmental factors such as traumatic or stressful life events may trigger or worsen symptoms in predisposed individuals. Cultural factors can also influence how symptoms manifest, though these disorders occur across all cultures and demographic groups. Diagnosis and assessment. Proper diagnosis requires a comprehensive evaluation by qualified mental health professionals. This typically includes clinical interviews, standardized assessment tools, and careful consideration of medical and psychiatric history. It's particularly important to distinguish between actual disorders and normal variations in personality, such as being perfectionistic or detail-oriented. Comorbidity is common, with many individuals experiencing other conditions like anxiety disorders, depression, or tic disorders alongside their primary diagnosis. This complexity necessitates thorough assessment for appropriate treatment planning. Evidence-based treatments. The good news is that effective treatments exist for these challenging conditions. Cognitive behavioral therapy, CBT, particularly a type called exposure and response prevention, ERP, is considered the gold standard psychological treatment for OCD. ERP involves gradually confronting feared situations without performing compulsions, allowing anxiety to naturally diminish over time through a process called habituation. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, has also shown effectiveness, especially for moderate to severe cases. Often, a combination of CBT and medication yields the best results. For severe, treatment-resistant cases, other interventions like deep brain stimulation may be considered. Living with OCD and related disorders. Beyond clinical treatments, lifestyle factors play a crucial role in managing these conditions. Regular exercise, adequate sleep, stress management techniques, and mindfulness practices can help reduce overall anxiety levels. Support groups and family therapy can provide much-needed understanding and reduce isolation. It's important to note that recovery is rarely linear. Symptoms may wax and wane over time, and stressful life events can trigger exacerbations. This highlights the importance of developing long-term management strategies rather than seeking quick fixes. Impact and burden. The impact of these disorders extends beyond the affected individual to families, relationships, and society. Family members often become unwittingly involved in accommodating symptoms, which can inadvertently reinforce the condition. These disorders can significantly impact educational achievement, occupational functioning, and quality of life if left untreated. Challenging stigma and misconceptions. Unfortunately, significant stigma and misconceptions surround these disorders. OCD is often trivialized in popular culture as simply being neat or organized, while hoarding may be portrayed as mere laziness. These misrepresentations undermine the serious nature of these conditions and can prevent people from seeking help. Conclusion. Obsessive-compulsive and related disorders represent serious mental health conditions that can cause substantial suffering. However, with proper understanding, assessment, and evidence-based treatment, recovery is possible. By raising awareness and reducing stigma, we can encourage those affected to seek the help they deserve. If you or someone you know may be struggling with these issues, remember that effective help is available, and reaching out is the first step toward regaining control and improving quality of life.